If you're over 65 and taking blood pressure medication, this might shock you. Your numbers may look controlled, yet your risk of stroke or heart attack could still be quietly rising. Many seniors do everything right, take their pills daily, avoid salt, see their doctor, and still wonder why dizziness, fatigue, swollen legs, or sudden spikes in blood pressure keep happening. What if the pills that once worked don't work the same anymore? Here's the uncomfortable truth most people are never told. Blood pressure medication doesn't actually fix blood pressure. It manages a snapshot of it. And at 65, your body is no longer the same system those pills were designed for. Let's slow this down and explain it in a way that actually makes sense. When you're younger, high blood pressure is often driven by one main problem: tight blood vessels. So doctors prescribe medications that relax those vessels, remove extra fluid, or slow the heart slightly. And for many people in their 40s or 50s, this works fairly well. But after 65, blood pressure stops being just a vessel problem. It becomes a whole body aging problem. Your arteries stiffen with age, not clogging, stiffening. Think of the difference between a new rubber hose and an old, sun-damaged one. Even if water pressure stays the same, the old hose behaves very differently. It can't expand, it can't absorb pressure. So the same medication that once lowered your numbers may now cause drops, spikes, or unpredictable swings. This is why many seniors experience something confusing: normal readings at the doctor's office, but dizziness when standing, fatigue after meals, or high readings late at night. The medication is still working on paper, but not in real life. Another major issue is something doctors rarely explain clearly: aging kidneys. Your kidneys play a huge role in blood pressure. Many blood pressure pills depend on healthy kidneys to balance fluids and electrolytes. After 65, kidney filtration naturally slows down even if your lab tests look acceptable. This means medication can linger longer in your system, build up, or suddenly act too strongly. That's why some seniors feel weak, lightheaded, or foggy, especially in the morning. The pill hasn't stopped working, it's working too long or too unevenly. Then there's the nervous system. As we age, the body's automatic pressure sensors, especially in the neck and chest, become less sensitive. These sensors normally adjust blood pressure when you stand up, lie down, or move suddenly. Blood pressure pills don't fix this. In fact, they can make it worse. This leads to a dangerous pattern called orthostatic hypotension, blood pressure that drops suddenly when standing. Many seniors fall not because of balance problems, but because their medication lowers pressure at the wrong moment. And here's the part almost no one talks about. Most seniors are prescribed blood pressure pills based on guidelines created from studies on younger adults. Very few large trials focus exclusively on people over 70, especially those with multiple medications, slower metabolism, or nerve changes. So doctors follow rules that don't fully match aging bodies. Another reason these pills seem to stop working is that blood pressure itself changes pattern with age. Younger people tend to have consistently high pressure. Seniors often have isolated systolic hypertension where the top number is high, but the bottom number is low or normal. Many medications lower both numbers. But after 65, lowering the bottom number too much can reduce blood flow to the brain, kidneys, and heart itself. This can actually increase risk even though the top number looks better. This is why some seniors feel worse after better readings. And finally, there's something deeply misunderstood: inflammation and vessel lining damage. As we age, the inner lining of our blood vessels, called the endothelium, loses its ability to respond properly. Blood pressure pills don't repair this lining. They don't restore flexibility. They don't improve circulation at the microscopic level. So, while the pressure reading may drop, the underlying damage continues quietly. This is where many seniors feel confused, frustrated, and even betrayed by their treatment. They're told to just adjust the dose or add another pill, without anyone explaining why the first one stopped helping the way it used to. But here's the hopeful part. Understanding this is the first step to regaining control. Because when you know why something stops working, you can finally address what's really missing. Here's what often surprises people the most. When blood pressure pills seem to stop working after 65, the solution is rarely more medication. In many cases, it's better support for the aging system that medication can't reach. Let's talk about blood flow first, not pressure, but flow. As arteries stiffen with age, blood doesn't move as smoothly, especially to the brain, kidneys, and legs. Medication can lower pressure, but it cannot improve how well blood glides through narrowed, less flexible vessels. This is why some seniors have controlled blood pressure yet still experience cold feet, leg pain while walking, memory fog, or fatigue after simple tasks. What actually helps here is improving vascular function, not just lowering numbers. Gentle daily movement plays a huge role, not intense exercise, just consistent motion. Walking, light stretching, slow chair exercises. These activities signal blood vessels to release nitric oxide, a natural compound that helps vessels relax from the inside. Pills don't do this. Your body does when you move. Another overlooked factor is dehydration. Many seniors are unintentionally dehydrated. Some blood pressure medications increase fluid loss, others blunt thirst signals. When the body lacks fluid, blood becomes thicker, circulation slows, and pressure regulation becomes unstable. This leads to morning dizziness, headaches, and sudden spikes later in the day. Ironically, dehydration can cause both low and high blood pressure at different times, confusing both patients and doctors. Then there's sodium, but not in the way most people think. After 65, aggressively cutting salt can backfire for some seniors, especially those with low diastolic pressure or nerve sensitivity. Sodium helps maintain blood volume. Without enough, the body struggles to keep pressure stable when standing or moving. This doesn't mean eating salty junk food. It means balance, not extremes. Something rarely discussed in a 10-minute doctor visit. Now let's talk about sleep, because this is where many blood pressure pills quietly fail. Blood pressure follows a natural rhythm. It should dip at night and rise gently in the morning. Aging disrupts this rhythm. Some seniors don't experience the nighttime dip at all. Others drop to low, starving the brain of oxygen during sleep. Taking the same pill at the same time every day ignores this rhythm completely. This is why some people wake up exhausted, with headaches or a racing heart, even though their daytime readings look fine. The medication is mistimed for an aging circadian system. Another key piece is gut absorption. As we age, stomach acid decreases and digestion slows. This affects how medications are absorbed. Some days the pill is absorbed fully, other days, barely at all. This leads to unpredictable effects: one day dizziness, another day high readings. This variability makes it feel like the pill stopped working, when in reality, the body stopped handling it consistently. Now let's address stress, but not emotional stress alone. Aging bodies experience physical stress from inflammation, poor sleep, blood sugar swings, and chronic pain. These raise cortisol and adrenaline, which push blood pressure up from the inside. Blood pressure pills don't block these stress hormones effectively. This is why seniors with arthritis, neuropathy, or poor sleep often struggle with stubborn blood pressure despite medication. And here's a crucial truth. After 65, blood pressure management should focus less on chasing perfect numbers and more on protecting organs: the brain, heart, kidneys, and eyes. Lower isn't always safer. Stable is safer. Many seniors feel pressure to hit textbook numbers, not realizing those numbers were designed for younger bodies with elastic arteries and fast recovery systems. The goal shifts with age. Fewer swings, better circulation, less dizziness, clearer thinking, safer standing and walking. Medication can still play a role, but it must be supported, not relied on alone. There are quiet warning signs your body gives when blood pressure treatment is no longer serving you the way it should. Most seniors are never told to watch for them, so they assume these changes are just normal aging. They're not. One of the first signs is frequent dizziness, especially when standing up or bending down. This isn't just a balance issue. It often means blood pressure is dropping to low at the wrong time, reducing blood flow to the brain. Falls that happen this way are one of the leading causes of injury after 65, and medication timing or dosing is often part of the reason. Another signal is constant fatigue, especially after meals. After eating, blood naturally shifts toward digestion. If medication has already lowered pressure too much, the brain and muscles may not get enough blood, leaving you drained, sleepy, or weak. Many seniors blame food or age, when the real issue is pressure instability. Pay attention to brain fog, trouble concentrating, forgetting words, or feeling mentally slow. When the bottom blood pressure number is pushed to low, the brain may not receive steady circulation. Over time, this can affect memory and clarity. Even though scans and basic tests appear normal, swollen ankles or legs can also be a clue. Some blood pressure medications relax blood vessels so much that fluid leaks into surrounding tissue. Could timing matter more than dosage now? Are my symptoms connected to my medication? Tracking how you feel is just as important as tracking numbers. Morning dizziness, afternoon fatigue, nighttime wake-ups, these patterns matter. Another important shift is monitoring blood pressure at different times, not just once. Readings upon waking, before meals, after walking, and before bed reveal patterns a single office measurement never shows. And here's something empowering. When blood pressure treatment truly works for a senior, life feels steadier. Standing feels safer. Thinking feels clearer. Energy doesn't crash randomly. Sleep feels deeper. Walking feels more confident. These are the real signs of success, not just a good reading on a chart. Aging doesn't mean losing control. It means changing strategy. Blood pressure pills were never meant to work alone forever. After 65, the body asks for more support, better timing, gentler targets, improved circulation, hydration, movement, sleep, and awareness. When those pieces come together, medication often starts working again, not because the pill changed, but because the plan finally matches the body it's serving. Many seniors believe that when blood pressure pills stop working, it means their body is failing. But that belief is both unfair and untrue. What's really happening is simpler and far more hopeful. The body is changing, and the plan hasn't changed with it. After 65, blood pressure is no longer just a number to lower. It's a system to protect. The brain needs steady flow. The heart needs rhythm, not stress. The kidneys need gentle support. And the nervous system needs stability, not extremes. Medication can still help, but it works best when it's part of a bigger picture. A picture that includes how you sleep, how you move, how you hydrate, and how your body responds throughout the day. When these pieces are respected, blood pressure control becomes safer, smoother, and far more effective. If you or someone you love has felt confused, dizzy, tired, or discouraged while doing everything right, know this: you're not failing. You're simply overdue for a smarter, age-aware approach. The most powerful step is awareness. Paying attention to how your body feels. Asking better questions. Listening to patterns instead of chasing perfect numbers. This is how real heart protection begins after 65. Your heart hasn't given up on you. It's asking for understanding. And when you respond to that request, the body often responds back quietly, steadily, and with strength that lasts.